Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Overdosing on cold and flu medications, over-the-counter, OTC, cough and cold medicines are widely available, low cost, and can help relieve some symptoms of upper respiratory infections and the flu. While they have some benefits, these medications carry a risk of overdosing. /r/n/r/n Overdosing of OTC cold and flu remedies is often accidental due to errors like misreading product labels or dosing. Sometimes, these medications are also intentionally abused. Signs of overdose include excessive fatigue or dizziness, sudden jitteriness, confusion, and more. /r/n/r/n This article discusses intentional and accidental overdoses of cold and flu medicines, as well as signs of overdose and medication abuse. /r/n/r/n Overconsumption of drugs found in cold and flu remedies poses health risks. These drugs include /r/n/r/n Using these medications with alcohol can also lead to overdosing. /r/n/r/n There are several reasons that accidental overdoses can happen with cold and flu medications, including /r/n/r/n Taking different OTC cold and flu remedies can cause an overdose if they contain some of the same ingredients. For example, if you were to take a multisymptom medication like NyQuil along with Tylenol, or Tylenol Extra Strength, for fever and pain, you could overdose on acetaminophen, which is in both products. /r/n/r/n Taking too much acetaminophen can potentially cause liver damage. This risk is even higher with alcohol. According to research published in the Journal of Clinical and Translational Hepatology, acetaminophen overdose accounts for more than 50% of overdose-related acute liver failures in the United States. /r/n/r/n Ways to avoid these mistakes include /r/n/r/n NyQuil Cold and flu is a combination medication containing acetaminophen, dextromethorphan, and doxylamine. Overdose side effects can include drowsiness, blurred vision, upset stomach, nervousness, or more serious side effects such as confusion, hallucinations, trouble urinating, and irregular heartbeat. /r/n/r/n Do not take more than 4 doses in 24 hours. See the directions on the box for the correct dosage for adults and children. /r/n/r/n NyQuil should not be used as a sleep aid. A 2015 review concluded there weren't enough quality studies to determine its safety or effectiveness as a sleep aid. /r/n/r/n Though you may never anticipate a cold and flu medication overdose, they can easily happen. It's important to recognize the signs of an OTC cold and flu medication including /r/n/r/n In cases of overdose, get emergency medical help or call poison control at 1-800-222-1222. It's important to get immediate medical care, even if you don't notice any symptoms yet. /r/n/r/n Several different ingredients in cold, cough, and flu medications can be abused. /r/n/r/n Some people abuse OTC cold, cough, and flu remedies containing dextromethorphan, DMX. These products are readily available throughout the United States in syrup, tablet, and powder form. Brands of cough medications containing DMX include /r/n/r/n There are over 50 brands of combination products, such as cough and cold, or flu, medications for both adults and children that contain DMX. Some examples include /r/n/r/n The abuse of DMX is most common among 8th to 12th graders. When swallowed or snorted in excess, DMX can cause hallucinogenic effects similar to the anesthetic drug ketamine or the street drug phencyclidine, also known as PCP or angel dust. Depending on how much is taken, the effects can last for as long as 6 hours or even more. /r/n/r/n The overuse of DMX is associated with an array of side effects, including /r/n/r/n. Repeated abuse of DXM at high doses can also cause a condition known as chemical psychosis, in which a person loses touch with reality. Referred to by some as poor man's psychosis, the DMX-induced disorder, characterized by paranoia, delusions, hallucinations, and disassociation, has been known to lead to impulsive and even violent acts, including assault and self-harm. /r/n/r/n. An overdose of DMX can lead to more serious symptoms, including seizures, cerebral hemorrhage, bleeding in the brain, permanent brain damage, and even death. /r/n/r/n. To prevent abuse in your family, educate your kids about the dangers of DMX, monitor their activities, keep track of all cold and flu medications in the home, and avoid stockpiling medications containing DMX. /r/n/r/n. Alcohol used to be a common ingredient in many OTC cough syrups. As a public safety measure, alcohol is no longer a component of most OTC remedies. However, some cold and flu combination medications such as NyQuil and Theraflu still contain alcohol. /r/n/r/n. Because fewer remedies contain alcohol, there is less of a concern for abuse. /r/n/r/n. Codeine has also been an ingredient in many OTC cough syrups that were abused. /r/n/r/n. As a public health safety measure, codeine has been classified as a controlled substance. Products containing 90 mg or more of codeine, like Tylenol 3, are Schedule 3 controlled substances and require a prescription to use them. /r/n/r/n. Since DMX abuse is largely hidden, it is important to recognize the signs of overdose. /r/n/r/n. If you suspect that someone has overdosed on DMX, call 911 if there are any of the following symptoms. /r/n/r/n. Until help arrives, call Poison Control 1-800-222-1222 for instructions on what to do. /r/n/r/n. While OTC cold, cough, and flu medicines have some benefits, they also carry a risk of overdosing, which can be accidental or intentional. If you're self-treating a cold, carefully read and follow product instructions and only treat the symptoms you have. /r/n/r/n. Know the signs of medication overdose and abuse to be able to get someone help if needed. /r/n/r/n. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.